This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
We've talked a lot this month about matters of the heart, and now as we wrap up Heart Month, we're tackling a condition that affects more than 5 million people in the U.S., heart failure.
Don't let the name throw you off. Heart failure doesn't mean that your heart has stopped working. It just means that your heart isn't pumping like it should to support your body. It is a serious condition. In fact, according to the Centers for Disease Control and Prevention, about half of people who develop heart failure die within 5 years of diagnosis. The American Heart Association says heart failure is one of the most common reasons people 65 and older are admitted to the hospital. But it's not just seniors. Heart failure can also occur in newborns, infants, toddlers, and teens. The thing about heart failure is it's manageable, and in some cases, it's treatable.
And that goes for both older and younger patients. Joining us today to tell us more is Dr. Jeffrey Wieland, Chief of the Division of Cardiology at Peninsula Regional Medical Center. Thanks for joining us this afternoon.
Thanks for having me here.
Okay, so when people hear heart failure, they think the heart is failing, but that's not necessarily the case.
Now, what really is occurring is that the heart isn't keeping up with the demands of the body. And there are a number of reasons why that may happen. We generally will break heart failure down into two types. One where the heart isn't pumping as strongly as it should, and the other where the heart isn't relaxing the way that it should. The first is called systolic heart failure, and the second is called diastolic heart failure.
Can you show, you brought your model, thank you for that. Can you show us what you're talking about, where you're talking about?
Yeah, so I brought my heart with me, and this is the left ventricle, which is the powerhouse of the heart. And this muscle pumps the blood out with each beat. Now, when the heart gets weakened or has systolic failure, the contraction is very weak and diminished.
Okay.
When people have diastolic heart failure, the heart muscle is very thick and the heart won't relax. They're both causes of heart failure and they are treated differently.
Okay.
So who's at risk for heart failure?
So the most common cause of heart failure is in people who have heart attacks. Multiple heart attacks cause the heart to weaken and no longer pump the way that it should. The other big cause of heart failure, and this applies to so many patients, is people with high blood pressure. Right. So if you think about high blood pressure, just like a bodybuilder who has to lift those weights, the muscles get bigger. And with the heart, when the heart has to pump against a higher pressure head, the heart muscle thickens. And so people with high blood pressure will get heart failure from diastolic heart failure.
Okay, but you're talking maybe kids too.
Yeah, so kids are different. We don't see heart failure nearly as often in kids, and fortunately it's fairly rare, but when we do see it, it's usually from congenital heart disease, and that is due to either a hole in the heart or some sort of defect in the development of the heart in utero. Now, with today's modern surgical techniques, oftentimes those problems can be repaired, and the child can have a normal development and grow into adulthood without any problems.
Now you're talking infants, but
yes.
Teenagers too?
Well, teenagers are a little bit different. We see heart failure in teenagers when the hole in the heart perhaps wasn't detected as a child, or after viral infections. And sometimes after a viral infection of any kind, you can get weakening of the heart muscle, and that will cause heart failure. Fortunately, often that viral cardiomyopathy, as it's caused, will improve with time.
So what are some of the symptoms of heart failure?
Yeah, so the symptoms of heart failure are reduced exercise capacity, shortness of breath, swelling of the feet and ankles, and sometimes waking up at night short of breath. So what happens in people who tend to have fluid in their feet is when they lie down at night, gravity is no longer keeping that fluid in their feet, and it goes up to their lungs, and so they wake up short of breath.
Oh, and weighing themselves is very important, isn't it?
Absolutely. So we have multiple treatments for heart failure, and we ask patients to try to keep track of their weights on a daily basis, because often a couple of pounds increase in your weight will be a trigger or evidence that you're starting to retain fluid and your heart failure is starting to get out of control.
So you said that's one of the options.
Yeah, so as far as treatment options for the heart, the medications that we use are beta blockers, what are called ACE inhibitors, which help relax the blood vessels that the heart pumps into, diuretics to help control fluid buildup. In more severe cases, patients sometimes will benefit from defibrillators and and heart transplant in extreme.
And Medicare is now accepting this as a diagnosis.
Yeah, it's certainly a diagnosis that they are trying to improve outcomes on, and they have recognized that regular exercise is an important way of treating this, and that has been manifested by the fact that they are now covering phase 2 cardiac rehab for people with heart failure. So I would encourage people who have either these symptoms or diagnosis of heart failure to be seen by their physicians and find out if they do have heart failure, and if they do, then move into a more aggressive treatment, which will include some of the medications we talked about and exercise.
Now, PRMC has programs that will help.
Absolutely. So the cardiac rehabilitation program would be at the top, and we also have a program where we have outreach from nurses to make sure that patients are not slipping back into heart failure. So they will contact the patient, make sure their weights are being checked, make sure that their medicines are being taken, and make sure that their symptoms are being controlled.
Now, despite all the treatment and management, there are cases where people just don't make it.
Absolutely, and that's why it's so important to be evaluated, because certain types of heart failure, the medications that we talked about and the treatments that we talked about will prolong life. So we do have treatments that are available that will prolong life, and the important thing is to be evaluated so you see whether it's appropriate for those patients.
Is there anything we can do to keep from getting in the first place?
It's sort of the same old song and dance to some degree with heart disease, which is a healthy lifestyle. So we want patients to not smoke, exercise, keep their blood pressure under control. If you're diabetic, have your blood sugars checked and well controlled, and then see your doctor and take your medications as scheduled.
Do what you oughta.
Yep.
Absolutely.
Dr. Wieland, thank you so much.
Thanks for
Appreciate you
having
coming
me.
in.
And to read more from PRMC about heart failure, go to WBOC.com, click on our picture at the top of the page.
How about a story that's going to warm your heart? It's a true medical rarity. Up next, you're going to hear how one baby boy's birth is giving doctors a glimpse of life inside the womb. Why doctors say his story is one they won't soon forget.
And when it comes to our kids, we want to do everything we can to protect them, especially when in the water. We'll hear about a couple of groups hoping to teach water safety from little up.
Plus, you don't necessarily have to be in a body of water to drown. Next, we're going to learn about secondary drowning and what signs may spell trouble. Delmarva Live, we'll be right back.